in New York. I'm Sue Goodwin.
Welcome, everyone. Welcome, dear listeners, to another episode of Darker Than Blue here in Washington, D.C. on WPFW, where we are changing the world one broadcast at a time.
I think something's wrong with your mic.
Something's wrong with my mic. Okay. Oh, sorry. We good?
Yeah,
All right. I think we've got our technical difficulties worked out now, folks. Thanks so much. Welcome to another episode of Darker Than Blue here on WPFW in the Washington, D.C., Maryland, and Virginia area. WPFW, where we are changing the world one broadcast at a time, here on Darker Than Blue, where we are giving you politics for the people who Curtis Mayfield said are darker than blue. I am your host, Jackie Lukman. Thank you so much for joining me today. I want to talk about what happened in this country on Wednesday, just this past Wednesday, that is still getting a lot of traction, as it should, not only because of what was done, which I guess I have to give the disclaimer that, yes, we do not approve, or no, we do not approve of these kinds of acts. We do, however, have to analyze why this might have happened, even though the media, the corporate media, is still claiming we don't know what the motive was. But of course, I'm talking about the killing of the CEO of United Healthcare that happened in Midtown Manhattan on Wednesday. We do need to talk about this because this has created something that I actually think was the reason this was done, part of the reason this was done. And here's why I say that. So on Wednesday, United Health is a big old gigantic insurance company in this country. The executive, the CEO, Brian Thompson, was killed in what has been called in the media a targeted attack. And this information is from Market Watch. So they say that Thompson was 50, led the company's United Healthcare division. He was shot in the back and leg outside of the Hilton Hotel in Midtown Manhattan at nearly 7 o'clock in the morning, 6:46. So the sun was out, it was light out, everybody could see what was happening, by an unknown assailant wearing a mask and a light-colored jacket, carrying a gray backpack. After the shooting, the shooter fled and then was spotted on surveillance video riding off on a city bicycle. So he did what he did, and then he hopped on one of those rental bikes. And from what from the way his departure was described, it wasn't like he was trying really hard to get away really fast. The article goes on to say that he was last seen entering Central Park and remains at large. The motive for the killing wasn't immediately clear, but I think we're clear now. But investigators said it appeared that Thompson had been targeted. New York City Police Commissioner Jessica Tisch said every indication is that this was a premeditated, planned, and targeted attack. Thompson was attending an investor conference that was across the street. Surveillance video showed that the shooter calmly waited for Thompson. He was standing outside of the hotel. A bunch of people walked by him. He knew who he was looking for, or because we don't know the identity of the shooter. They knew the shooter. They knew who they were looking for. They did not bother anybody else. They waited for Thompson in particular. The shooter had a silencer on his gun, obviously, so that is premeditated. Surveillance footage showed that the gun appeared to jam, but the shooter cleared it and fired again, and then calmly walked off across the street. That is what the article says. That's not what I said. Police said a wide-ranging manhunt was underway, still is. The person is still at large. Thompson has served as CEO of United Healthcare since April of 2021. He'd been with the company for 20 years, lived in Minnesota. Thompson's wife, Paulette, said he had received death threats recently. She said there had been some threats basically about, I don't know, a lack of coverage. I don't know details. I just know that he said there were some people that had been threatening him. I'm going to stop right there with the narrative about, who this person is before we get into the comments from the other filthy, stinking, rich, lying, stealing, coverage denial, denial of claims, perpetrating, thieving. Did I say they were thieves? The CEOs of other insurance companies and people who run these claims department in these insurance companies, these people who create these algorithms and these rules about what to cover, what not to cover, when to deny coverage, why coverage is denied, and they don't care about what the person who is making the claim needs, what they're going through, what conditions or diseases they have, how sick they are, how young they are, how old they are, how desperately they need the medication or the procedures that they're denying coverage for, how close these people are to death, whether the denial of their coverage will mean that those people, no matter how old they are, children, elderly, everyone else in between, will die. That is the reality of the insurance industry. So when the spouse of the victim of the murder, Jesus, it's hard to say that without explaining that you're not talking about all of the people who have died because they were denied coverage. And that is why I think this happened. I am not saying that this person is someone who either was denied coverage and suffered severe repercussions because of that, or is a relative of someone who was denied coverage and that person is no longer here because of that. We don't know. But I don't think this was a lover's dispute. I don't think this was done because of some business dispute. I don't think this was done because Thompson borrowed his neighbor's leaf blower and didn't give it back 5 years ago. I don't think this is a noise dispute. I don't think this is anything other than the natural consequence of what happens when you are in a business in which the business model is to make money off of denying health insurance coverage that your company is supposed to exist to provide people. But instead of providing coverage, you make the most money off of denying coverage, just so you don't have to pay for the coverage. You don't have to pay the hospital for what they are going to bill you for. That's how you make your profit margin. Yeah, you make plenty of money in your business, your health insurance business, just by people buying your insurance policies. Make plenty of money from that. But no, it's not enough for these CEOs of these insurance companies to just make all of the billions of dollars they do make from having to pay for their health insurance policies, their base level policies, the 2 steps up slightly better policies that still doesn't give you all the coverage you need. And then there is the what are they usually call them the bronze level, which is like the third place policy. Like the first two, if they have like a 5-level policy system, the first two are like bargain basement. Okay, I guess we'll cover prescriptions kind of coverage, but that's pretty much all you get. But then, most health insurance companies have this 3-tier bronze, gold, and platinum level insurance policy where you get the basic coverage in the bronze level, and then in the gold level you might, you'll get a little bit more coverage, but you'll get a higher deductible. Yeah. And you get higher out of pocket. And then if there's a platinum that has the highest deductible and the highest out of pocket, and God save you if they have a platinum or not platinum, diamond. That's what it is, a diamond level. Oh my God. So we all understand the problem with insurance companies. They do not exist to actually provide people access to health care. They provide insurance policies so people can afford health care, and people cannot afford health care with their insurance policies because they're charging people ridiculous amounts of money in order to buy their insurance policies. So even with the policies they provide, people still can't afford. They cannot afford those policies. And then they pay all of this money out of pocket if they don't get their insurance through their jobs. Because remember, most people in this country who work a job and get insurance coverage through their job, they don't work in these nice white collar, cushy, comfy, air conditioned office job. No, we're talking about blue collar workers and some low wage workers. And most of the low wage workers don't get insurance coverage through, especially a lot of the service workers, right? So these are not people who make a lot of money in the first place so they can afford insurance. So if they don't get insurance through their job, yes, workers have to buy it themselves, or they just don't, because they cannot afford it, and they hope they don't get critically sick because they have no insurance coverage, because they have no money, because they can't afford insurance. People in this country literally cannot afford to get sick because of the racket the insurance companies have going on with the CEOs, who are the employers, and the government. Yeah, that allows them to do this kind of thing. So when the spouse of the person, the CEO of United Healthcare, I'm just going to call him that because I don't want to call that man a victim, because that creates a whole bunch of problems. Because for me, I think I saw something earlier today, and I'm sorry that I didn't pull that social media post up. And you do have to check social media posts, because sometimes those memes aren't true, but sometimes they're spot on. But I did see a meme earlier today that said that last year, 210,000 people died in this country for lack of adequate health insurance. So those people are the victims in this situation, in this scenario. People who have to buy health insurance out of their pocket because they don't get it through their job, and because the federal government in this country does not want to provide health insurance for every American so that we can all live a healthy, decent, dignified life. I mean, did you know that if you have a healthy population, you will have more productivity, you will have happier workers, you will have more loyal workers, which means that everybody does well. And oh yeah, if you have a healthy workforce, if you have a healthy population, you have healthy students, you have healthy parents, you have healthy adults, healthy children, and you have a population that has a longer life expectancy. But that's not what they want in this country, because see, the longer people live, they're going to have to pay people Social Security. So this is why they keep trying to move the retirement age up to like 75, because they know that a lot of people who would otherwise qualify for those Social Security benefits upon their retirement, they know that most of those people will die before they hit retirement age. That's why they keep wanting to raise the retirement age for Social Security, because they know, the politicians in this country, in both parties, because we talked about a few weeks ago, then we talk about how both the Democrats and the Republicans have both wanted to cut funding for Medicare. And Biden actually did cut funding for the Medicare Advantage program during his administration. We talked about how both the Republicans and the Democrats have been threatening to cut Social Security, and both Republicans and Democrats have offered plans to each other to do that. So this idea that Democrats are more trustworthy or want to protect these social safety net programs, they're not entitlements. I hate that word, because Republicans have used it to make it seem like these are things that we are asking for that we do not deserve. This is our money. These are our tax dollars that go into Social Security, that go into Medicare. It's our money. So you can claim that I am acting entitled by demanding that the government give me my money that I paid into it specifically for my retirement. You go right ahead and call me entitled, but you're going to give me my money. Call me what you want. Call it whatever you like. But I call it giving me back my money. And that's what we all need to call it. And stop letting these people gaslight us in a conversation about their responsibility, number one, for handling our fiscal resources, and number two, for acting as if we are wrong for demanding that the government do its job by us, and to guarantee that our human rights, our right to health care, our right to housing, our right to a decent quality education, our right to an equal and just society, our right to a clean environment, our right to safety in our neighborhoods. That is the government's job, to take care of its citizens in that way, in those ways. What else is ensuring life, what is it, life, liberty and the pursuit of happiness? Yeah, what is that if it's not those things? I know that the white slaveholders were probably thinking of a lot of different things other than that when they wrote those words, but that's what those words mean. I know they meant something else. But we need to start demanding from them. We need to stop asking politely. We need to stop trying to negotiate with these people. You can't negotiate with terrorists. And these CEOs, they're terrorists. They are finance capital terrorists, baby. They are not people to look up to. They are not people to say, look, they achieved the American dream through all their hard work. The only thing these people have worked hard at is coming up with ways to rip the American people off by capitalizing on our human rights, commodifying human rights, every aspect of human rights, so that we don't get what we need to live dignified, decent lives as human beings simply because we're human beings, because we don't have enough money to afford that. That's what this country, that's what happens here. And this is not what happens in a lot of other countries, particularly countries that are socialist or have socialist aspects of their government. This is why these other countries like China and Vietnam oh shoot, I can't remember the African country right now, but Cuba and Venezuela. This is why they provide government-funded healthcare, housing, education, ensure environmental protections, because they're taking care of their people. Those are things their people don't have to worry about. But for us in this country, being able to afford to live is a common daily, minute by minute stressor. This is also one of the reasons we don't live as long, because the stress that we endure every day just trying to afford to exist in this society cuts our life short. We all know that stress is a major contributor to a lot of diseases. Why do you think Americans in the richest country this planet has probably ever seen live less long than people in so-called developing countries, countries that are not as wealthy as this country? Maybe it's because in those countries, the people in those countries don't have to spend their time, their life, and their health worrying about how they're going to afford rent, how they're going to afford food, how they're going to afford their kids' education. Because the governments in these countries guarantee that the people, their people, will have those things. So they don't have to worry about those things. Several big aspects of worry gone, taken away by the government. Because the government wants its citizens to focus on being good citizens of not just their countries, but of the world. And how do you become a good citizen of the world? You develop yourself as a human being, and you learn, you engage with other people, you engage and embrace other cultures, and you learn how to get along with people and operate in international solidarity. Not in this country. Nope, not in this country. The only thing we are told in this country about the rest of the world is that the rest of the world is backward, and this country is the shining beacon on a hill of freedom, liberty, and all the things that all of the other unwashed masses in the world don't have. We have all of those things. America is great, and everybody else in the world wants to come to America. That's not true. None of that is true. And I think this story about this CEO and the truth about United Healthcare and every health insurance company in this country that has been exposed because of what happened to this Brian Thompson person, I think this story and what it has exposed also reveals why, another reason why all of what I just said about America and what it is, shining beacon, all of it's a lie. Because so this is what was reported from, what is the name? This Fast Company, the name of this publication. They published this article on December 5th, yesterday, just 2 days after this happened. And they say gleeful social media response to United Healthcare CEO shooting reveals deep anger toward for-profit insurance. And I just want to say real quick before I read a little bit of this article, when the spouse of Thompson, says just kind of flippantly, I don't know why people, I don't know what the threats were, oh, maybe people who had lack coverage. Yeah. Yes, but it's more than that. It's not just people who lack coverage. It's people who will probably die because the health insurance they pay for is not going to give them the coverage they need to save their lives. So this is not just lack of coverage. This is, you people are killing me. You are signing my death warrant. You are signing an order of a lifetime of suffering. And that lifetime, now that you're not going to cover the medication and the procedures that I need to improve my life or to save my life, you are doing that to me. And I'm paying you every month. That's what, so this is not just oh, I guess people are mad because of lack of coverage. No, people are angry, outraged, enraged, because they are paying ridiculous amounts of money every month for insurance coverage that the insurance company that they're paying every month, anytime they feel like it, can decide, nope, we're not going to give you the coverage that you pay for. And if that kills you, oh well, we got our profits. So Fast Company says in this article, the apparent targeted attack on United Healthcare CEO Brian Thompson, who was shot early Wednesday morning outside his Midtown Manhattan hotel, has sparked a noticeably intense backlash on social media, punctuated by jokes about the tragedy. At this time, there is no known motive yet in the shooting. Just told you what it probably is. Anyway, on United Health Group's Facebook post, which announced Thompson's death, more than 37,000 people posted a laughing emoji, while one commenter wrote, quote, "I would offer thoughts and prayers, but they're not covered as they're out of network," end quote. The lack of empathy for Thompson and overall anger toward the healthcare system can be seen as a measure of many Americans' distrust of healthcare insurance companies and frustrations over increasingly high costs for monthly premiums, co-pays, and access to specialists, as well as a growing list of doctor visits and tests that are not covered by insurance. Quote, "When you shoot one man in the street, it's murder. When you kill thousands of people in hospitals by taking away their ability to get treatment, you're an entrepreneur," end quote, a user posted on X. Meanwhile, on Blue Sky, one user joked, quote, "My copay for thoughts and prayers is $100,000. I heard his condition was pre-existing. My ability to care was denied. My sympathy requires a referral. Submitting claim for condolences was denied," end quote. But another Blue Sky user pointed out the jokes about the United CEO aren't really about him. They are about the rapacious healthcare system he personified, and which Americans feel deep pain and humiliation about. I'm so glad that person used that word, humiliation, because do you know, I'm sure you do. This is a rhetorical question that I know you have an answer and an answer to and an experience with. Do you know how humiliating it is to have to sit in a doctor's office while they explain to you one of the probably most difficult times in your life, where somebody is telling you something that you don't want to hear about your health? And it could be very bad and very serious, and this doctor is telling you that yes, you've got a very bad and very serious problem, and this is all of the stuff we need to do in order to mitigate this problem so that you don't suffer, so that it doesn't get worse, and maybe to save your life. If we don't do these things, you're going to suffer, it's going to get worse, and you're going to die. So you're already having to deal with that. And you don't know how you're going to even go through the emotional and physical realities of what you've just been told, what you are faced with. And then you think about, wait, how much is all this going to cost? Because you know you can't afford the diamond or platinum plan. You couldn't afford the gold plan. You can barely afford the bronze plan, and you know the bronze plan does not cover specialists, doesn't cover a whole lot of specialized medication, doesn't cover a whole lot of stuff. So you are now faced with this very difficult and emotionally challenging news about your health and what you are facing, this long road of procedures and doctor's visits and tests and being poked and prodded. and maybe hospital visits and possibly procedures and surgeries and recoveries and pain and discomfort, and you are freaked out and you call your health insurance company to ask them, hey, my doctor told me that this is what I'm going to have to do. And they tell you none of that is covered. We're not, no. We're going to cover 3 days in the hospital, and you need to go home. And with United Healthcare in particular, their algorithm just this year created a new policy by determining that the insurance company didn't have to pay for anesthesia for the entire surgical procedure. I cannot even wrap my mind around this one. It's just United Healthcare's algorithm came up with this plan that said that they did not have to pay for anesthesia for an entire surgical procedure because the algorithm decided that it wasn't necessary for every surgical procedure to have anesthesia for the whole time. So the algorithm came up with this arbitrary time period of approved anesthesia. Like a surgery can't go past this arbitrary period of time that this algorithm decided that should be appropriate, and they actually thought this was a good idea, and they were going to do it. They were absolutely going to do it until Brian Thompson, you know what, and found out. And now United Healthcare is not going to roll out that policy. But just the idea that they were about to do something that was worse than what they had already done. And what do I mean by worse than they had already done? I mean that according to a lot of reports that are coming out about this now, United Healthcare's policy of deny, defend, and depose, this is literally their policy. That this is what they say their response to claims are: deny, defend the company, and depose. Sue people. What? How have they? Have they been bad for a long time? How about in July of this year, 150 people protested United Healthcare outside of the headquarters in Minnetonka, Minnesota. Their complaint, the number of claims the health insurer had denied. Market Watch reports that it's an issue of great frustration among the insured, exacerbated by a lack of transparency among insurance companies that don't publicly disclose their denial rates and have few requirements to do so under government regulations. So the government knows the insurance companies are killing people. They know that the insurance companies are arbitrarily denying insurance coverage for procedures, for medication, for tests, for doctor visits, even if the doctor themselves contacts the insurance company and tells them this patient needs this or they will die. The government knows that the insurance companies are doing this, and they don't care. All of the legislation these people on Capitol Hill find the time to throw together at the last minute, 3, 6, 800 pages of stuff that nobody reads. They just dump a bunch of crap in documents and say, we work together to pass this landmark legislation. Ain't nobody passing no landmark legislation to deal with these insurance companies, not just ripping people off, but facilitating the death of people due to treatable conditions and diseases that they could have avoided had their claims been approved. So Market Watch says, according to police, The bullets were marked with the words deny, defend, and depose. See, we didn't know that Wednesday. We didn't know that Wednesday. So these media outlets still talking about they don't know the motive for the kidney. Yes, we do. We know. What did I tell you the motive was? This has led to speculation in the media that the words were a reference to a 2010 book, Delay, Deny, Defend: Why Insurance Companies Don't Pay Claims and What You Can Do About It, which focused on insurance companies' efforts to avoid paying health insurance claims. Currently, United United Health Insurance has denied the highest number of claims among every health insurance company in this country. United Health denies 30% of their claims. No other health insurance company denies as many claims. One of the people who protested in Minnesota said, quote, "I have stage 4 metastatic lung cancer," meaning it's spreading. Yeah. "We just left UHC because of all the denials for my meds. She has cancer that is spreading, that is going to kill her more quickly without the medications, and she'll be in misery, absolute agony without the medications. Every month, there is a different reason for the denial," she says. "As of today, we are well over our max out of pocket for the year, with having spent well over $20,000. And this was Lisa Galeski. So they also say in this article, there are indications that denial of health insurance claims is generally on the rise because, again, I think we talk about pretty frequently on this show how, nothing is made and produced in America that everybody else in the world wants to buy, except for, the culture that Black folks create. But, and that, this country steals. But the only way corporations can increase their profits, not just make money, because they all make money, because we all need stuff, so we're going to buy it from somewhere. And things like services, these kinds of services, we're not going to get these from a retailer from another country. Yeah, we do have to buy these services like health insurance, homeowners insurance, car insurance, this kind of stuff from companies in this country, so they're going to make money. But what they want to do is to maximize their profits. Every year, they want to increase their profit margin. They want to make more money next year than they made last year. And if you're not offering anything new, different, or additional for people to buy, how do you do that? You start cutting people's salaries, you start firing people, you start taking away people's benefits, and then if you're an insurance company, you just start denying people the things that people are paying you for. That's all. So that is what this is about. That is why these health insurance companies deny claims the way they do, because that is the only way they can maximize their profits, increase and improve their profits. It's not that they're not going to make money. If they approve every claim, they can approve every claim and they will still make billions. But they don't want to just make the same billions they made last year. They want to make 20% more billions next year than they made last year. So they have to deny at least 20 to 40% of the claims, because that's how they're going to make that's how they're going to make their profit. That's how they're going to save that money. So when we have a situation like this, where, something horrible happened and you don't want to celebrate it because it seems very macabre, but then when you look at the person who was the target, and you realize that this person, this CEO, this very, very rich billionaire, because he is a billionaire, they made their money off of other people's suffering. Then the word victim takes on a different meaning. And then you start seeing this situation from the perspective of the real victims, the actual victims, the hundreds of thousands of people like you and me who get exploited. I had to think of a word that was not a cuss word by these insurance companies every day in this country, that contributes not only to our poor health, but also contributes to our level of stress, that also exacerbates our poor health, that contributes to our financial problems, which also could exacerbate our poor health. That's the crime. That is the crime here. Yeah, we should not run around killing people. Yes, I think that's okay, fine, I said it. Because I know somebody is listening who is like, but murder is wrong. Yeah, you're right. You're right. Murder is wrong. And denying people the resources they need to maintain and save their lives, how come that's not murder? And before we go to this quick break, I do want to tell you that this has had an effect on CEOs of other health insurance companies, but not in the way we would hope. Not yet. Because what has happened is that companies like CVS, Anthem, and other big corporations, what they've done is just do what do you call it? Window dressing. They've removed the executive photos from their websites. You know, they've taken down some of their social media pages. They've taken down the on the About Us page where they have the team and the pictures and they've taken some of that stuff down. They've taken down photos of their top executives, but none of them have changed any of their policies. Ain't no with the exception of United Healthcare and that evil, hateful algorithm and anesthesia policy that was found out. But none of these companies, not that we know of, not yet, none of these companies have changed their policies. And what we really need to happen, not as a result of this, not because of this, what we need to happen, period, because of the 212,000 people who died because of lack of health insurance coverage, what needs to happen is that health insurance needs to not be privatized in this country. Health insurance should not be tied to you having a job or you being able to afford it. Health insurance should not exist. It should not, nobody should need health insurance. The government should just pay the damn hospitals and doctors when we go. That's it. That is what needs to happen. I know people don't like the word socialism. Don't care. You can call it what you want. But it's either that or continued mass death due to the commodification of access to health care. One or the other. We have got to choose. Or how many more hundreds of thousands of people do we need to see die? And one or two of those people be someone you know before you decide you need to make a choice. Socialism or barbarism. More barbarism, because what is this if it's not barbarism? Anyway, got to take a quick break. Our esteemed producer, do we have a promo? Let's cue it up.
Chestnuts roasting on an open fire.
Happy holiday. I'm Robin Holden.
I'm Miyuki Williams.
WPFW is wishing you a happy holiday and are inviting our listeners to an open house extravaganza as we say goodbye to our 1990 K Street location.
We're offering our listeners and supporters this holiday gathering as a way of thanking you for your support on Sunday, December 15th from 4:30 p.m. until 7:30 p.m.
Stellar programmers James Funk,
Captain Fly,
DJ Lance Reynolds,
and DJ Abby will provide the music.
Food and drink will be made available.
Details, including how to RSVP, available at WPFWFM.org.
Happy holidays!
That is one of 3 approved Christmas songs that I can tolerate. I am so glad they did not make that promo with a Mariah Carey song, because I can't take Mariah Carey's Christmas songs anymore. And the producer also hates mine. So thank God. There are only 3 approved Christmas songs that will ever play in my house. And Nat King Cole's song is one of them. Of course, The Temptations and Stevie Wonder are the only other 2. That's it. So thank you all for letting me know, for my friends over on Black Liberation Media. Thanks for correcting me. It was Blue Cross Blue Shield that had that awful algorithm anesthesia policy that they rescinded after this happened, I believe. So thank you. I stand corrected. One insurance company did change their policy, but that's not enough. That is absolutely not enough. Oh, thank y'all. Yes, okay. Donny Hathaway. 4. Y'all don't suggest any more Christmas songs. That's it. That is it. I only need the 4. Okay. So the other thing I wanted to talk briefly about is people are kind of losing their minds about Trump's cabinet and department head appointees or potential appointees. And yeah, they're bad. I mean, these are terrible human beings. They're terrible human beings. They're awful politicians. They are monsters. We know they're not going to do anything good, but you know what I'm fitting to do. You know where I'm going. So you think the Democratic politicians are better? What do I say every week? They have better marketing. They have better marketing. They've got better talking points. But I maintain that they are just like the late Glenn Ford said, the Democrats are the more effective evil. And you can't be more effective at evil if you are running around like the Republicans do with their evil. They just come right out and tell you evil and do evil things and even have an evil laugh and all of that. Very cartoonish, very caricaturish. You can see Republicans' evil from space. It's not hard. Democrats, though, will literally do the same thing that Republicans do, will pass legislation that is oppressive, that is denying people rights, that is destroying the environment, that is denying sovereignty to indigenous people. Ruth Bader Ginsburg quoting the doggone doctrine of discovery in one of her rulings. Yeah, the Democrats will do these kinds of things, letting the insurance company executives write the legislation that was supposed to be the alternative public-ish health care or health insurance program that was actually a GOP health insurance scheme that isn't great, doesn't give us do you understand what I mean? The reason Democrats do the same things Republicans do, but they have us thinking that they're so much better than the Republicans, is because the Democrats just have better marketing and better talking points. They do. They will co-opt the language of the left and say the right words to y'all, and y'all believe that they are on your side. They are not. They are on the side of finance capital, which is why they're now in the coming weeks, it would be interesting to see the Republicans responding or addressing to the insurance company crisis. I'm not saying they will. I'm just saying it will be interesting to see what they do. And I don't know. I am not expecting anything, but look, these are weird times. We can't pundit. We can't do a whole lot of the commentators can't really comment, because who the heck knows what's going on anymore. But Trump is making all of these appointments, and people are just like, oh, these people are so awful. We talked a couple of weeks ago about people's fears about the Department of Education possibly being eliminated under somebody that Trump appoints. And we talked about how it was Barack Obama who invited the privatization pros, Arnie Duncan, Rahm Emanuel, who were working with, what's her name? Betsy DeVos, Republican Betsy DeVos. Already, the Obama administration had those people running the Department of Education. Arnie Duncan running the Department of Education. Arnie Duncan privatized the schools in Chicago. Good grief. So I say that to ask, where was your fear when Democrats appointed people or kept the same people that Trump appointed to run these agencies, and they did all of this terrible stuff to the people over the last 4 years? How about the 8 years under Obama? Where was everybody's fear about the appointments from Obama and Biden? I do remember people didn't like, I think, Biden's pick for, was the Department of Agriculture, I think. But other than that, y'all did not care about any of the awful people, the awful, like I said, finance capital loving, neoliberal, imperialist pushing, warmongering, poor people hating neocon liberals. It's the same system. It is the same system. And this is the point that I want to convey to people. The problem, thank you, New Orleans, I meant. Rahm Emanuel was Chicago. See, they all get mixed up in my head because they're all the same. They all do the same evil things, just in different places in this country. This country and the people who run this country in both parties, I am telling you, they are 4 bad horror movies in a trench coat. There's nothing admirable, decent, good, educated. There's nothing about these people that we should look up to, aspire to, because they know that the policies they push through these agencies, they know the policies are harming people. They know the policies are hurting people. They know they're denying people's rights. They know they're violating people's rights and bodies and property. They know. And they keep doing it because they profit off of it. They profit off of our oppression and exploitation. So the issue is not really who Trump is choosing to run these agencies and departments. Does the Department of Defense have legitimacy now because you don't like who Trump is going to appoint to run the Department of Defense? I mean, were you happy with the Department of Defense when Biden appointed Lloyd Austin? Were you a fan of the Department of Defense because a black guy was appointed to head? Really? Was the department? Do you got love for the DOD? because it's being head by a black man now, or the DOD is under the purview of a Democrat now? Are you telling me that this government and this system and the agencies within it that are all in the business of propping up the infrastructure that finance capital needs to exploit us and continue to make their super profits? You mean to tell me this system that exists to do that had legitimacy before Trump became president and decided and had the ability to appoint people over the agencies that do that in the system that does that to us? I submit to you that the problem is not Trump or his appointees. The problem is the system. The problem is the agencies. The problem is what they do, what they're designed to do, what they've been doing, what they've always done. And it has never mattered who has been at the head of any part of this system. Have some things been different? Yeah, some things, but not enough to justify presenting Trump being the titular head of this system, being a unique threat to some sense of legitimacy that people seem to not understand they are giving to a system that is illegitimate, exploitative, white supremacist, settler, colonial, patriarchal, and bloodthirsty, capitalist and imperialist, all that kind of stuff. Yeah, the system needs to go. The entire system, along with both parties and all of the representatives for and of it. So, thanks so much for joining me for this week's Darker Than Blue. We'll be back next Friday at 5 p.m. with a whole nother show. Until then, stay tuned for Garland Nixon and News Views. And then after that, chill out with the fantastic of musical programming of WPFW's Friday nights. Thanks so much for joining, y'all. Until next time, peace.